After getting familiar with HIV, how HIV infect, let's discuss the HIV antiretroviral therapy. So there are some general rules regarding the antiretroviral therapy that all are very much effective against HIV 1 and 2. There is an exception. In this exception, the fusion inhibitors and NNRTIs are not effective against HIV 2. Then HIV medication started at the time of diagnosis, and the criteria for diagnosis is there is a age-defining illness and low CD4 count, and also there is a high viral load. And this is they are the general rules. The first so let's discuss the antiretroviral medication step by step, how the virus enter, and then we discuss that in that segment, one by one. So the virus comes and infect at the host cell. The first step of virus is entry, and in the entry phase we have the GP120, which mediate the attachment of the virus. So the attachment of the virus, there are the attachment inhibitor or the docking inhibitors, and these docking inhibitor known as Maraviroc. They inhibit the docking process, and they inhibit via 120. So the Maraviroc, they prevent entry of the virus by inhibiting the 120, by inhibiting the glycoprotein 120. After Maraviroc, we have the GP. So now let's assume that the after attach at 120, the virus bind to GP41 and also the chemokines. So if we so this mediate the fusion and entry of the virus. So if we inhibit this process by an fuvertide, then we can eliminate the entry of the virus and prevent further integration and the rest of the replication process. So the fusion inhibitor consists of 120 GP120 inhibitor, which is Maraviroc, and GP41 inhibitor, which is Antiretroviral. So these tools are very much important regarding the entry of the virus. And in the Antiretroviral, we have discussed that Antiretroviral is not for HIV-2 type. So when the virus get entered into the cell, then it goes for the replication and uses reverse transcriptase enzyme. And if we inhibit the reverse transcriptase inhibitor, then we can inhibit the virus replication process. So reverse transcriptase inhibitor, the first type is nucleoside reverse transcriptase inhibitor. So there are some general rules that all nucleosides all require phosphorylation. The first clue, phosphorylation. Then all are nucleosides except tenofovir, which is a nucleotide. So they all competitively bind and inhibit reverse transcriptase enzyme, and all lack 3-end hydroxyl group, and all inhibit the replication process, which is a 3-end phosphodiester bond formation, which help in replication bond formation. So NNRTIs are very much useful. We use two NRTIs and one integrase inhibitor as a general principle to use to cure the disease of to treat the disease of AIDS. We also use zidovudine as a general prophylaxis and also a pregnancy prophylaxis to decrease the transmission of virus into the fetal transmission, to inhibit the fetal transmission. So let's discuss the side effect. The first side effect is bone marrow suppression. Replication is inhibited by reverse transcriptase inhibition, so it can also affect the host nucleosides and also inhibit the replication in the host cell. So bone marrow suppression is very much common. So bone marrow suppression, whenever a AIDS patient is under the treatment of antiretroviral medication and he is suffering from low levels of hematocrit and hemoglobin, then we can give him granulocyte colony stimulating factors, and also we give EPO in order to increase the levels of cells in the body. And the next is the peripheral neuropathy. All causes peripheral neuropathy, and all the nucleoside causes lactic acidosis. So in order to treat this lactic acidosis, we can switch with a nucleotide which is a tenofovir. And zidovudine can cause anemia because in fact the heme synthesis process. And also we have abacavir sensitivity. So always abacavir sensitivity, which is type 4 sensitivity, type 4 hypersensitivity reaction, and always go for HLA B 0570 5701 testing before giving the abacavir sensitivity, and in order to rule out that the person is not HLA B5 mutated with. So this is all the general principles of nucleoside reverse transcriptase inhibitor. Now we have the non-nucleoside reverse transcriptase inhibitor, and these two are very common. These are then. So we have the delaverdine and efavirenz and nevirapine. So remember these three words then. And the NNRTIs, they are the general principle of NNRTI. They not require any phosphorylation in order to get activated. Also, they allosterically, they competitively and require phosphorylation. They allosterically inhibit reverse transcript. It means that they bind to a different site for site of reverse transcriptase in order to inhibit its replication process. So the side effects are very much deadly, that the rash, that is Steven Johnson syndrome, and also toxic 10 necrolysis, and also it is these drugs are very much hepatotoxic and and we have medication in fibrins. So we have two V's in it, and it is causes 2V vivid dreams, and see which is a CNS effect. So we use enfibrins as a CNS effect, side effect of vivid dreams, hepatotoxicity, and also rash. So the next category of the antiviral medications are integrase. So after replication process succeeded, now the virus has its double-stranded DNA, and it can make can integrate that host that viral DNA into the host DNA by the process of integration. So integration process is happen by the help of integrase enzyme, and if we inhibit that enzyme, integrase enzyme, if we inhibit that enzyme, we can pretty much stop the replication process and cure the patient. So integrase inhibitor, they always related to muscles. So there is a myopathy which can increase the CK enzyme. So integrase or integrase, we can say that it can increase. The side effect is very much common, that increased levels of CK. So we prevent integrations. The last process in which the virus get integrated DNA, and also it is going to release its progeny and make the next generation viruses and spread into the bloodstream. That is the protease enzyme. The protease enzyme. So the protease inhibitor are very much have a suffix where. Never T is a protease inhibitor. So protease make protease prevent protease inhibitor prevent the assembly and also prevent the maturation of the new progeny viruses. So whenever there is no progeny, then the virus is now going to cure. So protease resistance is very much common in when we use as NNRTI antiretroviral medication as a monotherapy. So protease side effect is very metabolic. The first side effect is hyperglycemia, insulin resistance, and also there is a GIT intolerance, and also we have Cushing-like lipodystrophy, which is very much common. Then there is some drug specific disorder. For example, for the Indanavir, it is very much a kidney lover, so it can cause a nephrotoxicity, hematuria, and thrombocytopenia. And also we have so this there is a Rotenavir, there is a ritonavir, which is a P450 inhibitor. So if we use ritonavir, we can boost OCPs, warfarin. For example, the patient is on the OCPs and warfarin. So if we use ritonavir, we inhibit the P450 enzyme, and the substrate for the P450 enzyme get increased. So there is some other side effects of whenever the patient is AIDS positive, HIV positive, and he is using ritonavir, and also he is using other medications. So their side effect gets increases. So so for example, if the patient is suffering from tuberculosis and also he get HIV, and he is using rifampin, he is using a rifampin. So we have known that rifampin is a P450 inducer. So it decreases the level of all the medication used by the P450 enzyme. For example, it decreases the level of ritonavir. So we use rifabutin instead of rifampin, in order to maintain the levels of other drugs so that they can effectively work as well. So rifabutin. So this is the general side effects and the general mechanism of antiretroviral. We have covered all the phases of viruses. This is antiretroviral medication, and the general principle: protease inhibitor, integrase inhibitor, NNRTI. It is pretty much confusing. Pretty much there is a lot of information in this page, and it is very much tested, and it is very high yield. So this is the general information regarding which is very much highly tested in this in the USMLE segment. So next we will discuss the antiviral medications.